Okay, well, hello. Welcome to our Lightning Talk. We are the Love Her Collective, and we are a community academic partnership. And I have my amazing coworkers here with me. Can y'all introduce yourselves?
Yes, I am Kristi Gamarel, and I am a faculty member in the School of Public Health in the Department of Health Behavior and Health Education. My pronouns are she and her. And it is an incredible honor to be acknowledged for the work of the Love Her Collective by CEW+.
I'm Laura Jadwin Chakmak, she, her pronouns. I'm a research director at the School of Public Health and another member of the Love Her Collective.
And I am Raquel Trammell, best known as Miss Mouthy. I am a researcher on the Love Her Collective project, as well as a podcaster. So Mrs. Mouthy is a podcast that centers the narratives and experiences of trans women of color here in Detroit and the allies that love and support us.
The purpose of this webinar is, or our lightning talk, is to really highlight who the Love Her Collective is and why it's so important to focus on addressing the needs and achieving health equity for trans women of color. As people may or may not know, trans women of color have been erased and stigmatized and experience extreme violence across so many domains of their lives. And their voices are oftentimes not heard in research and policy. At the same time, they are at the front lines who are fighting for equity for a host of their community members and others. You will also hear from our founder, Bree Rivera, about why it's so critical.
And one thing that was important for us to go back is to lineage and origin and how things started and began. And I couldn't have this conversation without incorporating Bree today. And so Bree, could you introduce yourself for the people?
Yes. Hi, everyone. Bree Rivera, she, her. I live in Albuquerque, New Mexico, and I am the program officer of the Black Trans Fund, the first fund that resources Black transgender, gender nonconforming, non-binary communities from a place of joy and liberation. Super excited to chat with you today about research. Like at the time, and even still now, that research doesn't accurately speak to the lives of trans individuals, right? And so for me, the work that I embarked on at the University of Michigan was one, to create more avenues of being able to collect data on specific communities, Black trans communities, right? But then also, I really wanted to survive. And I was at a point in my life where folks were consistently asking me to show up and to do work without actually pouring into my pockets, paying me, thinking about how I was going to survive. And so, I wanted a place for the girls, for them to have autonomy over the work that they wanted to move, and for them to be resourced. It's so amazing to hear about all of the work that y'all are moving now in programs, and being very clear that TSOCP was doing that when I was in leadership. Also just really wanting to name that I think it's really interesting how, when I was the leader, Black trans woman, there were just so many questions about the work that we wanted to lead and why it was important. And so folks don't know that we expunged folks' records. Folks don't know we kept folks housed. Folks don't know we supported folks with job opportunities locally, nationally, right? And so
we started our initial project when you were first coming on board, Raquel, was to really do a series of focus groups. And that, I believe, let me look at my date real quick, was really in early 2019. We conducted a series of focus groups with trans women of color in Detroit, really to identify what are folks' top priorities and needs for programming and just in general related to health and well-being. And then we were able to follow up with a survey, the transformative survey, where we were able to survey 60 women from, I guess, in early 2020. And really kind of between those two qualitative and quantitative studies, we were able to identify how stigma and discrimination really fuel economic vulnerability, and how that really leads to these health inequities that we're seeing, as well as really mental health challenges from having to cope with that discrimination and stress. And so the kind of mental health focus really became the Kicking It with the Girls program that you're talking about. So we've been able to adapt an evidence-based program, the Seeking Safety program, to really meet the needs of trans women of color in Detroit. And
I think, if I'm being honest, it was the trust factor for me, right? Like with Bree being my mentor, and a lot of times, oftentimes, historically, trans women have distrust when it comes to organizations, research, and to know that, one, she believed in me enough to think that I could do this type of work, but also bringing people who she knew we would be in safe hands of was really important to making me feel like, okay, I'm excited about this. And then the intention. Nobody had ever asked us as a community what it was that we wanted. It was more so like, hey, this is what I'm going to do. And I'm going to give you an incentive, but there may not be another opportunity like this again. So it was like, okay, we're going to give you all our information, then categorize us as MSMs, and we don't actually be represented. And so this was the first time that I felt like it was for trans women, by trans women, and it represented us in the research from beginning to end.
I think that trans women and trans women of color have been a focus of research, as Kristi was saying, really within the realm of HIV focused research, but that there hasn't been as much attention paid to the needs of trans women of color, kind of health related needs outside of HIV, or kind of the programming and support for health promotion that trans women of color want and need, that isn't just specifically focused on HIV or on sexual risk. And so I think that that's something unique that we're kind of building together, is really finding ways of addressing those social and structural needs. And hopefully we're kind of advancing and getting better at that as a group as we move along. But I think that's something unique that we're doing, and really only we're able to do it through this very, community-centered partnership, working with trans women of color, both at, on our research team, as well as more community partners and folks who are implementing programs as well.
Okay, so the thing that I would say, I really love the fact of the intentionality behind how to incorporate women of color in research, and especially trans women that may not have access to academia in that way, but still having that lived experience and being very intentional of offering resources and opportunities, just to change that paradigm of how trans women experience research in academia.
I think y'all are working on it now, but like one of my biggest dreams was like, what would it look like to have like a research arm that's just like Black trans folks, right?
I would really love to see the barriers that sometimes hinder trans women to getting access to academia being something that's erased or eradicated.
Really focuses on the needs of trans women of color occurring all across the US, because we know that these inequities aren't focused just here as well. And
for me, my ultimate goal is actually that trans women of color are in these leadership positions in academia, who are creating the funding directives and also evaluating what gets funded, and are actually in academia writing the grants and leading the grants.
So again, this is your girl, Miss Mouthie, and this was our lightning talk. And so when you don't see me, you hear me. Till next time. Bye.